Hi, Dr. Chen. How are you?
Good. Thank you so much for having me.
Thank you. I was wondering if you could share a little bit to our audience about who you are and what you do.
I work as an addiction medicine specialist in an academic setting, running an integrated chemical dependency primary care clinic. I'm also the current governor of Northern California, ACP, as you mentioned, and also board member of the California Society of Addiction Medicine. Also, most importantly, am a mom to an 11-year-old going on 21, so a tweener.
How did you choose your career path in medicine?
I feel I didn't choose it, it chose me. I think I've tried to avoid it as much as possible for very long. I come from a family of physicians, grandparents, great uncles, who are physicians. I think being Asian, in some ways, it was expected that I either become a lawyer or a doctor or an accountant, something like that. And I avoided it. I went into film and television and did a whole bunch of other things, and then came to medicine later in life in my 30s.
No wonder you're so good at interviewing. You have the history in the television and film industry. But I wanted to ask you as well, like some of our students, they're still trying to find what lures them, both medical students and residents. And as they're trying to grapple through that, do you have any advice for them?
Be authentic, to listen to one's own heart, and explore and be curious, and to not live in fear of perhaps making the wrong turn. I've thought I chose what my career would be. I started out in psychiatry, and then I did a bit of neurosurgery, and then I came to internal medicine, and now addiction medicine. And now that's not because, I've been criticized for not being able to make a decision, being fickle or, indecisive. But that's somebody else's opinion. And I think I needed to do that to finally land where I landed. And who knows, it might not be the landing place. It may be just, a jumping off point again. But that I've always followed my heart.
So I want to pivot to asking you kind of a wellness question. And it really comes from your response just now about this idea of fear. I feel like now many of us are fearful in medicine, in life. Do you have any words of wisdom with regards to that?
I don't know, words of wisdom, words of experience. What Roosevelt said famously, there's nothing to fear but fear itself. Living in fear is imprisoning, and it's narrow, and it feels tight and constricted, and it can make us feel sick and ill and unwell. And I think I encourage people to live authentically, fiercely, as fearlessly as you can muster on a given day. And this way, there's a lot of freedom. We're afraid that we're going to lose a job, that we're going to say something wrong, that someone will fire us, that during rounds, I remember, this term being pimped. I just thought, this is a really odd way of conducting one's life, day in and day out, to be questioned this way. And it was explained to me the benefits of that kind of questioning, that kind of Socratic method in some ways. But at the same time, it just is just this culture of instilling fear and a fear-based life. I don't think it works ultimately. And I encourage people to break free as much as possible from that. And how you choose to do that is your own way of learning how to unravel a fear-based life. Some people do counseling, therapy, their spiritual work, meditation. However you choose, I encourage that, because when you're fearless, you're free. I always say you're free at that point. You can walk however you choose. This job doesn't work out, there will always be another job. I think physicians in training are resilient by nature. This teaching of resiliency, I think, also an odd concept. I think you can't make it this far into medical school, into residency, into medicine without already being resilient. And so not forgetting that you will always have work, you will always be needed, and don't be afraid of that, but be true to what you want to do in that. And medicine can come in all kinds of ways of practicing it, or it, it doesn't have to be all clinical. It can be all aspects of like advocacy, for instance. And people write about medicine, they do medicine journalism, anything. It can come in all forms. So not to be fearful that you can't do anything with it. And then you'll have more choices and you can feel free to practice the way you want to practice.
Now, transitioning over to our wellness quote. I don't know, do you have a wellness quote to share with our audience?
Be wise, treat yourself, your mind, sympathetically with loving kindness. If you are gentle with yourself, you will become gentle with others.
Again, thank you for taking the time to interview with us today, and we really appreciate it.
You're welcome. Thank you.